This is Dr. Owusu-Akyaw with OrthoVirginia. I'm a sports medicine surgeon specializing in hip and knee surgery. I'm also a physician for the University of Richmond. I have the distinct pleasure of sitting down with Mr. Tim Hightower. He's a legend of University of Richmond, NFL alumnus. Tim, thanks for joining me today.
I appreciate you having me.
Absolutely, yeah. We're going to be talking a bit about ACL injuries. I know you have some personal experience with the ACL.
I do.
Just some background for y'all, the ACL stands for anterior cruciate ligament, and we know it's a very kind of famous ligament. You've probably seen it on the ESPN ticker before. A lot of athletes will injure it because it's involved with keeping your knee stable during pivoting and coveting activities. Tell me about how it went down for you with your ACL.
Pivoting and cutting, exactly.
Yeah.
I didn't realize how many ACLs actually happen due to non-contact. You would think it's the contact, but for me, 2011, I'm playing in the game and doing, performing a routine, a move that I've done hundreds of times, right? Like I see the whole, I run the play, execute the play, having a great game. Next thing I know, I go to cut back and I just feel something give out. I feel my knees shift.
Okay.
I never experienced that feeling before, but I knew something wasn't right.
Okay. So nobody hit you?
Nobody hit me. No. I saw a lot of green grass, and the next thing I know, I'm laying on the ground, grabbing my knee, trying to figure out, what's going on, and a lot of pain, and it was a long process.
Yeah. What's going through your mind when it first happened? I know it's a lot of things happen.
Well, look, immediately you go from being like part of being a professional athlete. There's like this superhuman persona that you put on, right? And your ability to perform at a high level, performing a high skill set at a high level. There's like this superhuman kind of identity that you take on. Immediately in that moment, like that all goes away. Like that superpower is like gone. Like you feel that you're laying on this field, you feel helpless, you have no clue what's going on, what just happened, and when this situation is gonna like be fixed, like when it's gonna be changed. So I just remember sitting there thinking like, man, what is going on? How did this happen to me? And like, where do I go from here?
Yeah. So you saw the team doctor immediately after, or what happened next?
I saw the team doctor. A little stubborn. You used to getting knocked down. For me, as a former running back, you used to getting knocked down, but part of the game is you get back up.
Right.
You get back up, you shake it off, you walk it off, you get back in the game. And again, I never experienced that level of pain and that injury. So for me, the team doctor already knew, right? When they came out in the field, they did something, they knew, right? You all have the experience. I didn't know.
Yeah.
So my mentality was still, I'm going to shake this off. I'm going to figure out a way to get back in this game. He's trying to get me to the locker room. So there was a dynamic going back and forth where a refusal to accept what happened. And at a certain point, he was able to guide me back to the locker room and kind of share to me what, the concerns and what we need to be careful for, look out for.
So there was some imaging that happened next. I'm sure an x-ray happened. Just for y'all's reference, the x-ray is more of a diagnostic study looking at just the bone. Looking at soft tissue like the ligament, you need to get an MRI to look for an ACL. So you got an MRI at some point.
I got it right away. Right away. As soon as we flew back, I went right to the hospital and got an MRI. So we knew right away, confirmed his concerns at the game. Yeah, so I knew right away.
Yeah. So you get the MRI, confirm the diagnosis. It's an ACL tear. Did you have a big sit down with the doc at that point, breaking it down?
Yeah, I was there, but I wasn't there. Fortunately, my wife, now girlfriend at the time, she heard, you kind of black out, and once you hear, you hear that prognosis, and he starts to articulate, and I just go, your mind is automatically going towards all the different scenarios and why and how and what and this, and so it was a lot of white noise for me, honestly, and just I couldn't really process what was going on. But he did come out and share what happened, what they saw, and kind of what are the next steps. Honestly, I don't remember much of any of that, but we did have a good conversation about it afterwards. And that was the start of course, a series of conversations and care and things like that.
Yeah, ideally, it's a shared decision-making process.
Right.
It's not the doc just dictating to you. Did you feel like it was like that?
Yes, and look, I did delay the surgery. Again, there's like this. I can't speak for everybody, but from an athlete standpoint, and there's like this refusal to accept like your immortality.
Yeah.
Right. And when something like that happens, it's like, no, I'm going to figure out how to get back on this football field somehow, some way. I'm not going to get this surgery. And so to the team doctor's credit, they weren't forceful. They shared kind of the pros and cons. And I'm like, hey, has anyone ever played without ACL?
That's right.
Right? What's the likelihood? What's the long? I'm asking all the questions to see if there's any possibility for me to get out there. I think there was like this refusal to accept like the reality. But then at a certain point there was, hey, the longer you delay the inevitable, like the longer you're taking now, the longer the longer it's going to take to recover. And I think once that's right, it's like, hey, you want to get back to playing, the quicker you get this done, the quicker you can start recovering, the quicker you can get back to doing what you want to do at a high level. And I think that was the final kind of like that, being able to kind of connect those two for me to connect it to like the next goal, right? Because this goal right now was like done. It was over. So how can I connect to the next goal? And I think they did a good job with that.
I think patients really benefit when they can see the whole pathway. It's right? The next step, and the next step, and the next step. So it's not so daunting. So it's right. Here's 8 to 12 months. Here's your 6-week goal. Here's your 12-week goal. Yeah, you push on from there. So what kind of graft did you have for your ACL?
Patella tendon. Yeah, for me, it was the way it was described to me, and you're the expert here, but the way it was described to me, there was the pros and cons of, between the patella and the hamstring, and being a high level athlete, it was advised to utilize the patella tendon.
Oh, 100%.